Good afternoon, everyone. Thanking you all for joining us. My name is Matt Bourne, and I'm the Executive Director of the Association of Defense Communities. For over 40 years, the Association of Defense Communities has been supporting the resilience of communities and states that support America's military. With nearly 300 communities, states, regions, and affiliated industry organizations, ADC represents every major defense community and state in the nation. I'm joined today by my battle buddy, Kathy Roth-Duquet. Kathy is the CEO and co-founder of Blue Star Families. Welcome, Kathy. To kick things off, would you like to tell folks a bit about Blue Star Families and the COVID Military Support Initiative?
I would. Thanks, Matt. Blue Star Families is a national nonprofit dedicated to supporting active duty, Guard, Reserve, veterans and their families from all ranks and services. Our mission is to support military families in ways that strengthen communities. And that's why we really love partnering with ADC, because they're all about communities. We're proud to partner with ADC on this COVID-19 Military Support Initiative. This COVID-19 Military Support Initiative will provide resources and expertise to support communities, states, service members, and military families through this crisis. It includes hosting events like this one today, a daily newsletter, and a new website that was launched this past week. This work would not be possible without the generous support of our sponsors. This initiative is powered by Booz Allen Hamilton with significant support from USAA. I also want to recognize the Bristol Myers Squibb Foundation, the Association of Military Banks of America, the Military Housing Association, Hunt Companies, JP Morgan Chase & Company, and First Command Financial for their contributions. As part of the initiative, we have been conducting a pain points poll to gauge the greatest challenges our military families are facing in light of the COVID-19 pandemic. We are continuously analyzing this data as policy changes and developments continue to roll in. A link to the pain points poll will be in your post-webinar email. We hope you will take a minute to take the poll and share the poll with your contacts. We have questions that are both aimed at community members and at military families. In our third week, we've had 3,245 respondents to our poll so far. 83% of week 3 correspondents were from active duty families. We're increasing the number of our veteran families. Now that's at 19%. We have some overlap in families that are on both sides. Our most acute pain points each week is something we like to highlight. 40% of respondents who require childcare report that they cannot currently use their normal childcare option, and that's up from 27% in week 1 of polling, so that's a steady increase. 13% of military respondents indicate that they or someone in their household is at high risk of infection and they're unable to shop for groceries or medicine due to fear of exposure. We asked people about solutions. 62% of military family respondents say a grocery delivery service is needed to better support their community during the outbreak. 61% of respondents with school-age children report their child has had behavioral changes due to the COVID-19 related changes, and we're seeing that number increase over time. It was 42% in week 1. That was just a brief overview. We have many more findings, which you can find at the COVID-19 militarysupport.org website or at Blue Star Family's own site. And now I'd like to turn it back over to Matt for the rest of the town hall.
Thanks, Kathy. So now I would like to let you all know how you can ask questions of our panelists. We plan to have a robust Q&A period after the first discussion here in a few moments. We know many of you have these questions about the uncertainty surrounding your communities and how installations are working with community leadership to make sure that service members and their families have the right information. Our panelists will do their best to field a few questions, time permitting. Any questions that do not get addressed will be downloaded by our team. We will work to get answers to those questions and get that information up on our website. I do ask you to please be patient, though, as we are navigating through information that is frequently changing, and we want to be able to provide you with the most up-to-date and accurate answers. So with that, I'd like to introduce Sal Najomian, City Council member of Niceville, Florida, which is right outside Eglin Air Force Base. And Sal is also the CEO of Matrix Design Group. And he's going to talk a little bit about today's panel and then dive into the discussion. So Sal, over to you.
All right, thanks, Matt. And Matt and Kathy, thank you both on behalf of numerous defense communities around the country for all the work that both ADC and Blue Star Families is doing. These town halls are a tremendous asset to many of us, as you can tell by the number of people who are dialing in and by all the information you've been able to gather and share. I'm going to also thank in advance our panelists, the ones that you see here on the screen today, for taking time out of their schedules to share some ideas with us as they relate to working as one community. Again, the title of our session today, Working as One Community, how military states and local governments are working together to respond to this COVID-19 crisis. I'd venture to say that everyone who's on the phone right now understands the deep connections that exist between installations and communities. I don't think we'd be part of this session if we didn't. Personally, I've seen it from both sides. As Matt said in my introduction, I'm currently an elected official here outside Eglin Air Force Base, but in a previous life, I was actually the installation commander of Eglin Air Force Base. So I've had the benefit of looking at the issues, the challenges, and the opportunities literally from both sides of the fence. Both the installation and the community, I can tell you, are highly, highly dependent upon each other. In my capacity with Matrix, I've seen pre-COVID-19 examples of communities installations working as one all around the country. Many of the communities that are probably on this phone right now, Joint Base Langley, Eustis, and the Hampton Roads area. Our friends up in Columbus, Georgia, and Fort Benning, right down the road from where I'm sitting right now with the West Florida Defense Alliance and their bases, NAS Pensacola and Whiting Field. We've got a very Army-centric panel today, but I would tell you the issues we're going to be talking about today transcend the type of uniform you wear. They're true for the Navy, the Air Force, the Marine Corps, heck, even the Coast Guard as they integrate within our communities. So I guess my final kind of introductory comment that will launch right into the panel is that in times of crisis, we find ourselves seeing the very best in people and sadly sometimes the worst in people. I am very excited to hear from our panelists about how this COVID-19 pandemic has actually brought out the best within their communities and installations. So our order of battle is going to be relatively simple. I'm going to start with a pair of speakers that come from the same area and toss kind of a general question their way. And hopefully it lines up with some of the things that they've been successfully executing. And then I'll move to the next set and so forth. So we'll start off with our friends in Maryland. So Colonel Sprague, the Garrison Commander of Fort Meade, and Lisa Svoboda, who's the Senior Director of Military and Federal Affairs for Maryland Department of Commerce. Great to have you both on. I'm going to give you a pretty generic question. As you guys are working through this crisis, which is now several weeks old, what are some of the things that you are doing to maintain critical services and support for the essential personnel and their families? Obviously, Fort Meade, very, very important installation and not something that we can just walk away from in times like this. So I'll go to you guys.
Oh, am I off mute now?
Oh, okay, Lisa, I got you now.
Okay, there we go. Sorry, I had to play with the mute button. Thanks, Al, and appreciate ADC extending the invitation for us to participate today. So in Maryland, this week, we've seen Maryland's total number of those testing positive that has risen to about 9,000. We have over 43,000 that have tested negative, but those numbers aren't trending downward. So what we have found at the state, and I think what we see nationally, is communication is key to overcoming this pandemic. And whether it's communicating of what your state's mandates are, what CDC guidance is, but within our networks to make sure that the information is trickling down to all levels. So on Sunday, Maryland rolled out a zip code map depicting where the largest concentrations are in the state. This data includes a breakdown of the number of deaths by age and race, and has really allowed us to statistically show the disparity by race, which has helped us as a state understand where we need to be directing our resources to where they're needed the most. And right now in Maryland, it's Baltimore City, Prince George's County, and Montgomery County, the city and suburbs where the majority of Maryland's minorities are located. The NCR, the National Capital Region, is predicted to be the next hotspot. So while this has been ongoing for a month plus, we still are in the thick of it and making sure that we are engaging all of our stakeholders in our economy, and particularly on the federal government side, as that's a tremendous sector in our state. We're working very closely with Governor Northam and Mayor Bowser in DC to mitigate the spread of the virus. And as we know, it's a health crisis, but also an economic challenge. So we are still trying to understand the full extent of the impacts of the coronavirus. We are in close communication with our military installations to understand what the impacts are to their defense community, to their supply chain, to their mission, and what we as a state need to be doing, and how we can best position ourselves to make sure those critical missions continue to move forward. So I know just a couple of things that we have done more on a state level that do get pushed out through our defense community network. Our Maryland Department of Veterans Affairs, their e-newsletter continues, and they've incorporated a lot of COVID-19 updates to keep the military and veteran community informed, which includes thousands on their subscription list for the newsletter. They're running a spot on Maryland Public Television, encouraging veterans to contact the Veteran Administration with questions and concerns. I know we are looking at individual sectors, industry sectors, and what those impacts are to the supply chains. So another way that we're going to be tying in our military installation and leadership to help identify key businesses within their supply chains that have been impacted. The National Guard, I know, is set up a makeshift field hospital at Baltimore Convention Center, and they have a COVID-19 testing site at Washington Redskins FedEx Field. So the National Guard has, I think it was one of the Guard units that had been deployed very early on in the nation to help with this crisis. The Coast Guard Yard here in Baltimore, they are partnering with the Maryland National Guard to provide lodging and messing capacity for those Guards service men and women that are responding to COVID-19 efforts in the Baltimore area, including staffing drive-through COVID-19 testing sites. There's a testing site that's immediately adjacent to the Coast Guard leased property there. BWI, our airport's also serving as a decontamination site. So I know that we're installing equipment from Battelle that the nation is going to be using to sanitize up to 80,000 PPEs per day using a hydrogen peroxide sanitization process. We have a lot of military installations. I know you said that this panel is Army heavy, but a lot of our military installations, including our Navy and Air Force partners, are partnering with local industry and the state on supplying PPEs, masks, ventilators, but then also in communication, partnering closely to make sure that we are tied at the hip and understanding what the impacts are, and making sure the information from the federal that comes down to the state level for mandates are shared throughout the workforce. So Colonel Sprague, if you want to chime in, the commanding officers at the installations have been great partners with us. The line of communication has remained open. Before Colonel Sprague chimes in, I'll just say, I know he's done the same, but we see it at Fort Detrick. There's a lot of communication taking place with emergency management folks at the local level. I know the APG Emergency Operations Center attends weekly meetings with their county, Harford County, on weekly pandemic calls. When APG first had a COVID-19 positive case, the senior commander established an immediate line of communication with the county executives in that region and reached out to them directly. I know Colonel Sprague has done a fantastic job hosting town hall meetings and making sure, again, that line of communication remains open with his office, within his defense community, and with local partners in the state.
Lisa, that was very thorough. Is Colonel Sprague, are you on?
Yes, sir. I'm here. Can you hear me?
Go ahead. You want to add on to Lisa's comments?
Yeah, please. And thank you for allowing me to participate in this webinar. Since mid-March, Fort Meade, in conjunction with our state and local partners, have implemented a multitude of prudent response measures designed to protect the force so our force can protect the nation through our national security missions. But these measures have come at a cost. And to say that these measures are an inconvenience is a gross understatement. In fact, they've been extremely disruptive, especially to our military families. But these are absolutely the right responses. So Fort Meade, as Ms. Swoboda alluded to, is right smack in the middle of Washington, D.C. and Baltimore, Maryland, on the Baltimore-Washington corridor. Of the approximate 60,000 joint service members, civilians, and contractors that work on Fort Meade, roughly 45,000 live off the installation in Anne Arundel, Howard, Baltimore, Montgomery, and Prince George's counties. Now, this is important, and I bring it up for a reason. Because if these responses implemented at Fort Meade are not in concert with those of the state or county executives, we're just placing even greater stress on our most precious resources, and that's our people. So how have we worked together with the state and local governments to maintain critical services and support for essential personnel and their families? And I believe it starts with how you define essential personnel. I believe everyone would agree that our first responders, so our local law enforcement, our emergency medical services, and our firefighters will always be considered mission essential, regardless if it's a pandemic or a man-made disaster similar to the events of 9/11. But up to this point, not too many people would have considered a cashier or a stock person at the grocery store or a child care provider as mission essential. But that is absolutely the case with the COVID-19 pandemic. Having these services available to the workforce enables our tenant organizations, our units, and our agencies to continue their respective mission sets. And as for the military units assigned to Fort Meade, every single service member wants to be considered essential. I mean, at the end of the day, they all raised their right hand and swore an oath to protect and defend the nation against all enemies, foreign and domestic. And as we've seen with the case of COVID-19, that enemy is also uncertain and invisible. So our tenant commanders and directors had to make some very tough but deliberate decisions that balanced health and safety of their employees and their service members with mission assurance. So they've achieved this balance in a very efficient and effective manner. And this is no different than what our governor and our county executives have done. So that kind of gets after the first half of the question. The second is focus on partnerships with state and local governments to maintain critical services and support. So this begins with clear and consistent communications with our workforce and partners. Over the last 3 weeks, the garrison, in conjunction with our Army Medical Center here on post, have hosted 10 virtual town halls. And last week, we were fortunate to co-host one of those town halls with the Anne Arundel County Executive, Mr. Stuart Pittman. Not only was this reassuring to our Fort Meade residents that the county and installation are nested, but it provided the county executive an opportunity to discuss other county impacts, including the Anne Arundel County Public School System. So in case you're not aware, there are 7 county public schools located on Fort Meade, all of which have been closed due to the COVID threat. So beyond the educational aspect, these closures have also impacted the school lunch program. And it was only through that partnership with the county and superintendent and the county executive were we able to bring the service back to Fort Meade while ensuring non-DOD students who were attending our schools had access to those meals. So that kind of gets to and just really complements what Ms. Swoboda said. And I thank you for your time and your attention, and I look forward to any questions you may have. Thank you.
Sir, thank you very much for your insight. Thank you for your continued service, not just to the installation, but to our country. Fantastic examples between both what Lisa and Colonel Sprague shared there. I'm going to pivot to Bill Perry out in Gatesville, Texas, and Colonel Westbrook, if he's on from Fort Hood. And Bill, what I'd like to throw your way maybe, and then the Colonel, is in events like this, and absent information, people tend to make up their own. And that is highly, highly dangerous, as we know. What are you guys doing together to ensure transparency about what's occurring, and frankly, as it really ties back to mission readiness, especially when you think about Fort Hood and the mission of that installation? Over to you, Bill.
Okay, Sal, thanks very much. And I think Lisa did a great job of kind of giving you a setup. So let me do the same thing for Texas and Central Texas in terms of the number of confirmed cases and deaths so far. And these numbers were as of last night, but in the 4-county region around Fort Hood, so that would be Bell, Coryell, Lampasas, and McLennan County, which I count because we're relatively close to that. We have a large number of residents of Gatesville that work in the Waco area. We had 191 confirmed cases statewide. There were 14,011 confirmed cases, so a significantly lower amount of positive cases in Texas than perhaps on the East and the West Coast. As of last night, there have been 299 deaths, and we've had 6 deaths locally. Those numbers do not include Fort Hood, nor do they include the 6 gated communities, otherwise known as the Texas Department of Criminal Justice facilities located here in Gatesville, but those numbers are relatively low. So we've had about 1.4% of the statewide total of confirmed cases here. And we'd love to be able to say that, you know, social distancing is working. However, it may also be a function of we're lower on the priority when it comes to testing. And I think that's one of the things that we need to be very transparent with our residents about, is that at sometimes just because of a lack of testing, our numbers may in fact appear a little bit lower. But my job is to keep the residents informed and make sure that they're practicing safe social distancing and limiting person-to-person contact, but also staying tied in with Fort Hood, largely because the city of Gatesville provides both water and wastewater services to North Fort Hood, which is a mobilization force generation installation with a lot of mobilized reservists in and out. And so we need to know what the rules are so that I can ensure that my employees are following the rules, because they're on Fort Hood on a daily basis. And I know that's one of the challenges that Colonel Westbrook would like to talk about, is in terms of force protection and how he synchronizes that message with local communities. So let me get off and turn it over to Colonel Westbrook.
Okay, thanks, Bill, and thanks for Matt for having me on here. I'd like to start really with a little bit of context, just to put Fort Hood for the people that may not be familiar with Fort Hood into context. So what makes us unique is that you know, when you look at Fort Meade or you look at Redstone Arsenals, we are one of the readiness installations for the Army. We fall under Forces Command, and we have 36,000 soldiers stationed here with 49,000 family members. And we cover an area of 342 square miles, so about the size of Fort Worth, Texas, for folks that are familiar with Fort Worth. Gatesville, up where Bill Perry is up near North Fort Hood, which is approximately 20 miles straight line distance from where I'm at. And he mentioned the cases in the local 4 surrounding counties. And while I won't mention specific numbers, but what I will tell you is, you know, when you look at that population of 85,000 soldiers and family members, and then you add in our Department of the Army civilians and our contractors and our other workers on the installation, only about 22% of our personnel assigned here actually live on Fort Hood. The other 78% live in the surrounding communities and counties. And we early on developed a procedure for reporting. So Fort Hood reports to the state of Texas those cases for COVID that live on Fort Hood. But those that live in the surrounding counties, we work with those health departments to report those cases that live off of the installation. And so, for example, when he mentions the 191 in the surrounding 4 counties, Bell County has 107 reported cases. Coryell County, which is the county that Gatesville is in, has 34. And so some of those are tied to Fort Hood. Fort Hood is the single largest single site employer in the state of Texas. So we touch have people touching all the counties and where they live. What I tell you is, when we look back to the question, which is how are we working together? One of the other panel members said, consistent communication, and that has to happen on a daily basis. As we look at North Fort Hood and understanding the readiness requirements up there, Bill mentioned our mobilization and force generating installation mission. We're one of 2 active MFGIs for the Army, and that activity for us takes place primarily up at North Fort Hood, where we're mobilizing and then demobilizing National Guard and Reserve component units that are deploying and coming back. And so that mission hasn't stopped, even with coronavirus ongoing. In fact, we got a number of units that came back from overseas and ended up having to quarantine up at North Fort Hood for 14 days. And the interesting piece that came out of that was, of all those soldiers that came back from these countries around the world where they quarantined up at North Fort Hood, we've had 0 positives in that population up there at North Fort Hood. And then when you look to the rest of the installation, Fort Hood deployed medical units out of our 1st Medical Brigade to Seattle and to New York City to help support the coronavirus efforts. And they're still out there executing the mission, and we still have our core headquarters deployed in Iraq and other formations deployed around the world. So our mission hasn't stopped. And much like the other installations in the cities that are out there, we have our standard services that make a city run that still have to continue to operate. And so I think, when we look at the mission readiness requirement, while we've slowed our training requirements, we're still doing some training here at Fort Hood, primarily for our first responders, our emergency services personnel, and some aviation training. But really, it's tying into the local community, the school districts, the local counties, and making sure that each of us knows what the other is doing, and we're synchronized across our workforce, because most of the workforce doesn't live on Fort Hood, it lives in the surrounding communities. And I hope that gets to the essential portion of your question there. And again, thanks for having me, and ready to answer any questions if anybody should have some.
Yes, sir, it does. Thank you very much, Colonel Westbrook. Between you and Bill, your perspectives on that and the importance of the communications between installations surrounding communities. Again, no different than most of the bases around our country. The old model of everyone living on the installation, working on the installation, getting all services from the installation is a relic of the past. And the reality is we're so deeply integrated that to look at it as an installation problem or a community problem is flawed at best. So moving to
Sal, this is Lisa. If I could just jump in just to comment on that. So when the governor set out a bunch of mandates, as every governor did within the first matter of weeks, and a lot of us were challenged with revising and updating mandates as information was flowing in, particularly as it relates to who's essential and who's not in the workforce, the critical workforce. We received a number of inquiries from not just defense contractors, but also employees on the installations that are spouses of military uniformed servicemen and women inquiring and reading information and taking it one way and assuming it's another. So we were responding to a number of questions coming in from all facets that the state put together and launched just this past week or recently a Maryland COVID-19 rumor control page. So everyone can go to this rumor control page and look up, you know, a lot of rumors that you have heard about coronavirus, but also those related to the mandates and how that is defined and interpreted for an individual or for a worker. They can also go and submit questions that they individually have about the state's response to the coronavirus, or submit questions to health officials at the states regarding the virus itself. And so we found that as a factual, transparent way to communicate information to the public and to help also control a lot of unnecessary panic that seems to be occurring within our communities.
Thanks, Lisa. Yeah, you know, misinformation, disinformation, lack of information, again, is the root of that exact question. So thank you for adding another example of the importance of transparency. So let's head over to Alabama now, and we'll check in with Mike Ward, who's the Senior Vice President there at the Chamber for Government and Public Affairs, and his counterpart, Colonel Smith at Redstone Arsenal. And for you gentlemen, I'm going to kind of throw maybe a couple questions because we've kind of hit the first one, but I want to have you reiterate, you know, times like this, I'm reminded of the kind of the old 3 rules of real estate. Well, there's also the 3 rules of crisis, and that's communicate, communicate, communicate. So if you can talk a little bit about lines of communication, and then I'd like you to maybe hit on support for small businesses that are being impacted. You know, speaking as a CEO of a small business, and I know many others on the call also have financial equity. Plus, we have so many of our spouses, military spouses, who work for businesses. You know, with 16+ million people on the unemployment lines, these are real issues. So, Mike, let me start with you, and then we'll go to Colonel Smith afterwards.
Sure, I'm happy to respond, Sal. Appreciate the opportunity to talk with you, and Matt, appreciate you putting this together for us today. Yeah, the community has gone into kind of hyperdrive, I guess, when it comes to our efforts to maintain the lines of communication. We have a daily teleconference with the local mayors, the chairman of the county commission, EMA, HIMSI, which is the local ambulance service, Redstone Arsenal, and the local hospitals. And in that daily telephone conversation, we discuss kind of situation awareness. We're also talking about if there's any shortages of materials anywhere that they're experiencing, what we might be able to do to help address those. And of course, Redstone's communicating their situation as well in that telephone call. We also followed that daily teleconference up with a TV show. So there's a live streaming TV show that features on a rotating basis participants from that earlier teleconference. And then the chamber hosts a daily Zoom meeting with our membership that'll include local mayors and then kind of featured guests. We've had Senator Jones, Congressman Brooks, other representatives from the community, from the health community, and from businesses as well. So we're doing, I think, about everything we can to help keep those lines open. Colonel Smith, do you want to kind of frame Redstone for the group and then talk a little bit more about what you're doing?
Sure, Mike. And again, much as all of us have said, thank you for inviting us to be here today. Very similar to what Colonel Westbrook communicated, Redstone, unlike your typical Army installation, Redstone Arsenal is what we consider a federal center of excellence. Redstone's primary mission is research and development, specifically aviation and missile. And along with that, we have a consistent or large presence from Army Futures Command to assist us with that. as well as a NASA facility, Marshall Space Flight Center, and then the Department of Justice, both BATF, and the FBI have considerable presence here. So as Jason discussed, he talked about the number of soldiers and folks that live on the installation, and what makes RSA, or Redstone Arsenal, unique, and why we are so intertwined with Huntsville and the Tennessee Valley community is largely because of our 44,000 employees that work on the Arsenal. Only about 350 families live here at any given time. Of those 44,000, only about 60,000 are DA, Department of the Army employees, and then the other 40% are federal. And likewise, 60% of them are federal employees, and 40% of those are contractors. So you can imagine, of the 44,000, only about 1,000 are service members, and the remainder are all civilians of some type, whether it be federal, DA, or contractors. And then in addition, Redstone Arsenal, we are blessed to have a significant number of retirees that depend on Redstone Arsenal for the delivery of those benefits and annuities. You know, approximately 150,000 to 200 use Redstone Arsenal specifically throughout the year. So what we find ourselves struggling with each day is to continue the testing requirements, the research and development and testing requirements. And as Jason explained, while training has been limited, it's still ongoing. Well, the same exists here at Redstone. Is each and every day we continue to test, or to research and develop, and we continue to test, and finding the balance between mission essential personnel and then right-sizing those services to not only support that mission, but to support the beneficiaries is what we at the Garrison find ourselves struggling with each day. What we have found, much like everyone has discussed here, is that communication has been essential to what we do, or how we continue to determine what services we provide, and then to fight the rumor control. As Mike discussed, we meet weekly with the Madison County Huntsville Emergency Management Agency, as well as with the state COVID-19 task force. And then we meet weekly with our tenant commands, virtually, of course, to communicate the precautions that we're undertaking here and what we expect to see. And then we, much like Eric, in fact, I think I took a page out of Eric's playbook. We offer virtual town halls every Thursday. And I'll say that initially I was resistant to virtual town halls, but we find that the better we communicate to the population, the more our population helps us to answer the questions that pop up in those virtual town halls. So it's been something we initially weren't going to do, and we find that it's very useful today. And then additionally, communication, our PAO with the city PAOs, both Huntsville, Madison City, and Madison County. Those PAOs get together weekly with our tenant commands and ensure that our messages are uniformly consistent with one another and synchronized. We're able to talk about what precautions both the county, the city, and the installation we expect in our future, so that we can begin to message them and communicate to the population early enough. And that seems to have alleviated some of the anxiety. And then additionally, I've partnered up with my hospital commander here. And because we do not have a bed hospital, we only have a healthcare center, we work directly with the county and with the city hospitals, as they are going to be the primary care providers for our entire population. So ensuring that the precautions we take support how the community can support our workforce has been our top priority. We realize we we rely on our community, and our community has done us very well. I think I'll pause at that point, and I'll take questions later on. I appreciate the time. Thank you again.
Al, just to follow up on the second half of your question, which is the support we can provide for small businesses. Of course, we've been very involved in sharing information about the CARES program, the Payment Protection Program, EIDL loans. We've been involved in active discussions about how we go about reopening, our state to business as we expect the pandemic to wind down, and of course, advocating to members of the congressional delegation on key provisions to include in relief legislation, things like equitable adjustment to contracts affected by COVID, things like that, so that the contracting community is able to continue to function.
Yeah, that's great, Mike. And Colonel Smith, thanks. I think the last things that you said are going to be really important for a lot of firms as we try to get out of this thing. This was a significant economic event in addition to being a medical event, obviously. And business as usual getting out of this is not going to work. I think there's going to be some creative acquisition strategies and things like that. And hopefully that might be a topic for a future conversation. Matt, maybe we can tee something like that up as well. Okay, let me go to our last pair of speakers here. We've got Ty Kimes, Missouri Chapter Director for Blue Star Families, and Carissa Poe, Tennessee Chapter Director and Regional Manager. Two questions for you, and I think we heard kind of one side of the answer to this one already, and that was from the installations. But I'm going to ask you guys as the recipients of the message. Do you feel there's been adequate communication from the installation and community leaders to families? Are they getting it? We've heard town halls and PAO coordinated messages, et cetera. And then kind of a follow-on question is, what do you think are the key challenges the military families are facing in your area, bearing in mind that we had seen the pain point chart earlier in this presentation?
Okay, this is Carissa. So here at Fort Campbell and in the Clarksville communities, in response to whether the communication is adequate, overall, I do feel that there is adequate communication regarding pertinent information. It is being disseminated through various means. That's either through the installation, direct messaging, social media posts. Also, there have been live streamed town halls with the garrison commander and the installation commander. Also, I feel as if leaders in our community are communicating effectively. Additionally, in addition to that, I also feel like here at Blue Star Families, we've implemented a weekly email that we send out to our chapter membership. And with that email, we include, of course, valuable news that they can use, virtual events that are happening, as well as I feel like it generates a pulse check for families. It generates that they feel like they need to respond. They're responding to chapter directors, letting them know how they feel, letting them know what they need and how supported they are feeling during this time. And as a follow-on to that, as one of the key challenges here that families are facing, I would say dependent child continued learning opportunities. With that, I said many families are facing issues of adjusting to the new school at home requirements. They're finding it difficult to balance working from home or having to physically go to work and monitor their children learning. And in response, schools have been sharing an overload of resources available to families, and staff has been made available to support those families. And in response to the school closures due to the COVID-19, the on-post schools at Fort Campbell, they quickly pivoted to virtual platform and several in-person sessions daily. And many families are truly enjoying that their children are able to interact with their teachers and their peers as it speaks to the social interaction that we all love. And it helps to combat that isolation. And with regards to the on-post continued learning, while I've not personally heard of many issues other than that of working parents who have now had to shift to assist as best they can, or thoughts surrounding the workload, especially from those with multiple school-age children. But many families are just doing the best they can. On the other hand here, the off-post schools have implemented a continued learning library that allows the opportunity for children to choose from a multitude of resources and complete assignments that are not mandatory or graded at their own leisure. It is also commendable here in Clarksville that the teachers touch base with families once a week to maintain that relationship and offer encouragement and support. However, many families with older students, including myself, have found that the learning platform has been very stressful and difficult to follow, as there is no continuation from where the students left off when school closures occurred. Most of the lessons are only refreshers that have already been taught. My daughter, who's an 8th grade student, she's been struggling during this time. She stresses me every day because she's afraid that she will be behind when the new school year occurs and she starts high school. She also reminds me that she's a structured learner and she learns best through the instruction of a teacher than being assigned tasks that tie into the lesson. She's usually a straight A student and I'm usually a hands-off parent, but I've been forced to be very lenient, allowing her to manage her learning because, of course, I'm still working full-time and I don't want to add to the stress of her being out of her environment in which she actually thrives. Her teachers do call every Monday and they seem to know her and always have the right words of encouragement. So although we face this issue and this challenge, I do believe that parents understand that the school district is working as hard as they can to be inclusive, knowing that some homes are without internet. And in response to helping the parents, also here at Blue Star Families, we've partnered with the Military Child Education Coalition Parent-to-Parent program, where we have parent educators from Fort Campbell who offer weekly workshops to educate parents on additional ways they can support their children at home, such as building portfolios, teaching them the value of money, building strong families. Additionally, right before COVID happened, we were able to have an event where we were able to issue portals to families, and we received feedback from families that the portals have allowed them to help their children through learning when there is one electronic device that may have been in the house. Also, the family can practice social distancing and, of course, connect with other family members. So as chapter directors, we're just we extend encouragement and support to parents to keep up the great work and to support their children as best they can. And we here at Blue Star Families, we listen, we share, we partner, and we act to find solutions to military life challenges. So we look forward to continuing to support families through these challenges of their child education during this time.
Thank you for having both of us, Sal, Matt, Kathy. We're really appreciative. Carissa, you did a great job with kind of highlighting and wrapping up the adequate communication from the installation and community leaders. But Sal, you mentioned in the beginning, bringing out the best in our community. And I have seen so much goodness come out of all of this. For example, for Fort Leonard Wood here, the installation commander, much like Redstone Arsenal and at Fort Meade and other installations, they have been doing a wonderful job of those town halls, just as Carissa had mentioned. But, our Command Sergeant Major James Breckenridge, he's been hosting, virtual events weekly that are informative, timely, and helpful. He kind of has like a broadcast. He's calling it break time instead of like break time. And that has been really, I think, important to kind of tie in the community. So that consistent communication that we've been hearing and everyone has been mentioning is really important. I think every installation is doing their best with that. Regarding the key challenges for Missouri here that the military families are facing, I kind of look at it as three kind of main challenges: social isolation, limited activities for student-age children, and an increase in stress from compounding duties for military families with a deployed service member or a service member who has an essential employee. The mission of Blue Star Families is to bring community together and bridge that divide. So we as chapter directors, we really take it very seriously, the issue of combating social isolation. One of the many challenges of being a military family is you're oftentimes separated by great distances from military family members. You may be separated from your spouse because of deployment or an unaccompanied tour. You may be separated from parents, grandparents, sisters, brothers, because of where you're stationed. So personally, I wanted to do something positive for our families here that would break from the news and the negativity that we sometimes, we can get bogged down with in times like these. So I've hosted a virtual 14 days of Blue Star Family giveaways, and I challenged each family daily to do something that would encourage healthy and safe practices, such as kids' jokes, sharing those, talking about saving. Prizes that we gave away were books, bubbles, crafts, and anything that would serve as a reminder to take a minute to focus on the individual and the family. I've had numerous military spouses contact me to thank me for hosting these lives, as it gave them something to look forward to. We've also been able to give out the Facebook portals to our military families, and I made it a priority to get out as many as I could while staying in compliance with all safety regulations. For one veteran member, retired Staff Sergeant Angela Pollock, in October, her husband, Jason Pollock, was diagnosed with cancer. They have a daughter who lives in Anchorage, Alaska, and they haven't been able to see her because of this pandemic and because of Jason's compromised immune system. The portal has now allowed them to see their daughter and talk to her every day. Another military family, Kelly Watson, a military spouse, has said that her 10-year-old daughter, she's actually taken over the portal, but she's able to connect with her grandparents and her friends, and it's helping her daughter cope. Military spouse Loretta Mass, she has a 12-year-old who can now go live with siblings, aunts, uncles, where before they had to use a tiny phone screen. She said they can all communicate and see each other. Loretta has thanked Blue Star Families for giving her family back. I want to add that partnerships with other organizations, such as the Fort Leonard Wood Leadership, USO at Fort Leonard Wood, and the Sustainable Ozark Partnership, we've been able to get more portals out to service members and families who need it most because of being in quarantine or dealing with complications of a PCS move. They're living without their household goods. Our mission to bring the community together and combat isolation is something that we're really working hard to address, especially during this time. So I just wanted to say all the chapter directors were all really working really hard, trying to come together to do virtual story times, to do Purple Up events, just anything that we can to stay connected. So I wanted to end with that, just bringing out the best in our community we should highlight that more. We need more positive. Thank you.
Yeah, absolutely. That's such a great way to kind of wrap up the prepared remarks from our panelists. Thanks for bringing it back to my opening statement of, worst of times bring out the best in people. And I think from all 8 of you, we heard some great examples of that. We have been getting some questions in here, and I'm going to go ahead and pick a few of these. I don't know how many we're going to get to, given where we are on the agenda right now. This first question, I'm going to ask each of our 3 garrison commanders to answer. I think it's appropriate for all. Eric, I'll start with you, then we'll go to Jason, then we'll go to Kelsey. So the question is, have any of the installations seen an increase in soldiers needing assistance from Army Emergency Relief or other branch relief societies? Does the command continue to brief on aid societies as a resource for financial hardship? Eric, let's start with you.
Hey, thanks. That's a great question. Yes, we have seen an increase, but not a significant increase. And again, when you have junior enlisted and their spouses showing up, or they are affected by a stop movement, meaning their PCS to another installation has been delayed, their household goods might have been picked up, or they have moved here, their household goods have not shown up yet, then those services such as AAR are perfect for them. So we are encouraging that. Now, that is one of the services that obviously still continues, but we're doing it virtually. There's no degradation in the mission and supporting our service members and their families. Kelsey?
Okay. So from Redstone, interesting. We have not seen a growth in our AER employment. Largely, I kind of attribute that to the reason specifically is really to our makeup. Is the majority of those that we typically see at RSA's or AER are retiree related, and at this point in time, we have not seen those. We typically will see those more related to weather events, but we haven't seen a growth here. Over.
Colonel Westrock.
Okay, so from Fort Hood, much different makeup of the population here with the young soldiers. An interesting point was before COVID-19, we saw about, on average, 15 AER requests a day. And since COVID-19, that's gone down to 3 requests a day on average. So we haven't seen an increase, but like Eric briefed, or not Eric, but we still have some people that were frustrated in their moves. But the point that I would make is that the Department of the Army workforce and the DoD workforce, the soldiers, the DA civilians, they enjoy the benefit of still being paid while we work through this. So whether we're working or we're in weather and admin leave for our civilians, I don't know that they're spending as much money since they're not going anywhere. That's kind of my observation. Over.
All right, thank you, sir. I'm going to stay with you. Keep the hot mic there. Are installations having issues maintaining the supply chains that are necessary for daily operations or family support services? So Colonel Westbrook, we'll start with you, then we'll go out to Meade and then down to Redstone.
Yeah, so I guess the one that I have really direct knowledge of is because I spent a lot of time in our commissaries. We saw an initial surge of the commissaries doing 4 to 5 days of sale every day, which kind of wiped out the shelves. The clerks, the commissary employees were working to stock the shelves as quickly as they could. And we went to a controlled supply rate, if you will, limiting some of those in-demand products. But over the last couple of weeks, we've seen the supply line for the commissaries catch back up and not limiting anything now. In fact, when you go into the commissaries, they seem to be fully stocked with vegetables, meat, and everything else that soldiers and their family members, our civilians and retirees need. As it relates to other resources that units and such would use, high demand for cleaning supplies. And it took the supply chain a while to catch up on that, but it has. But the rest of the supply chain, when it comes to maintenance parts and repairing equipment and such, we haven't seen a degradation in that.
Fort Meade?
Hey, sir. Yeah, and I think if you ask, Kelsey will say the same thing, and Jason put it best. Commissary was kind of the, I won't say the first casualty, but everybody swarmed the commissary and basically took it bare bones, took everything out. So just like what they did at Fort Hood, we had to begin rationing high demand items. COVID does not discriminate, so it's taken out employees that work for DECA, which then further exacerbates the problem. So we ended up working with the U.S. Army Field Band, since their TDYs and their performances have been curtailed through COVID. And we're actually using them at the commissary to help stock shelves. Same thing with the cleaning supplies, high demand wherever you go, whether it be hand sanitizer, the Clorox wipes, and what have you. So that remains a challenge, along with just the personal protective equipment, face mask in particular. But I think, there's a lot of clubs and organizations out there that have really come together and made these and are donating not only to our health providers, but also to our service members. Over.
Colonel Smith?
And Eric is exactly correct, as well as Jason is. The commissary was the first casualty, and since the supply chain has worked itself out, and then I'll jump on with Eric, and I think it's the PPE for those first responders has been relatively easy to make sure that our supply chain as well as our stocks are on hand. The personal fascination with PPE has given us some trouble here of late, but like Fort Hood and Fort Meade, is our local community, the entrepreneurs and the volunteer groups are certainly helping us out to provide those cloth face coverings and so forth for the community. But I think the lesson learned for delivery of services has really been identifying those ways that we can still deliver the service, the essential family services, not when you need to pick up a physical item at the commissary of the PX, but your CAC ID updates or any other services. To find a way to virtually do that has been something we've had to explore, and we've opened our eyes to a lot of new and different ways to provide services in the future. Over.
Thanks, sir. Next question, I'll start with Mike and then Lisa Pylon. It reads, here in Monterey, several of the cities and chambers are working with the Community Foundation to develop grants and loans for local small businesses. Cities and chambers and the foundations are raising funds for these loans. This is being done in anticipation of the Fed programs not meeting all needs. Is anybody else doing this? We feel like we're on the front end looking for other experiences that we might also learn from. Mike, you want to start? Mike might be muted.
Oh, sorry, there I am. Yeah. We do have a community foundation that has been able to meet some of those needs. Of course, we were primarily directing people toward the federal programs, the EIDL loans, and the PPP payment, the payroll protection program. That funding did, of course, break loose this week. So we've seen a number of defense contractors and other people who've received their funding there. I think initially they've been about $150 billion in funding that's been approved. We expect the PPP to be exhausted in the next couple of weeks or less. Of course, Congress is at work on a phase 4 funding program that will replenish the PPP and the EIDL loans. So we're hopeful that that will continue to meet most of the needs. Of course, our unemployment compensation programs have stepped up, and in addition to granting coverage for all 1099 employees and others, regular employees who've been furloughed or just sent home. In addition to the standard state benefits, they're receiving the $600 federal supplement that again started last week. So so far we're having a good experience with access to those federal funding.
Thanks, Mike. Lisa, anything in the state of Maryland that you'd like to share?
Sure. So we have, I think it's over 92% of our lenders right now throughout the state are approved for PPE loan creditors. We're pushing the federal information out as much as possible. Everyone has the federal information. We've developed a lot of state programs. Our challenge, I think businesses are challenged in trying to figure out which programs that they're eligible for, because everyone has this influx of information coming out as to assistance. It's trying to then filter through which ones are most appropriate for which business. So we developed in Maryland and rolled out recently what's called the Maryland Business Relief Wizard. It's a online tool that can help Maryland businesses quickly identify state and federal relief resources that they would be eligible to receive. So a link to that is included on a web page that we have created that is dedicated to Maryland coronavirus information for businesses. It's a web page that has links and information to all federal and state programs, as well as local programs within counties, and also information again on employer and worker assistance, licensing and permitting, utilities, everything that they would need to know about as it might impact their business related to closures due to the coronavirus. We also have, I don't think it's been rolled out yet. I think it'll be newly rolled out within this week, an online portal that will connect those that are unemployed to free educational resources to help those upskill. So when the economy is back up and operating, that they will be in a strong position to apply or reapply for their jobs. But yes, we have a lot of information out there. It's just trying to help the small business entity identify the best program to provide them financial assistance during this time. And we're hoping that what we call the Maryland Business Relief Wizard will help do that online for them, to direct them to the right individual to have the conversation about the program.
That's great. That's tremendous to hear about all these different resources. I know we are a little bit over our originally planned time. I want to try to get one more question in. Maybe I want to pose this to our friends from Blue Star Families. So this is for Carissa and Ty. How are communities handling internet access for education for those who can't afford it? Both of you had made some commentary about homeschooling and all those requirements. Do either one of you want to comment on that question?
You know, I can kind of jump on that if that's okay. This is Ty. I am here in the Waynesville R6 School District. One thing that they have done for those families is they set up a set location, which is right outside one of the schools. And so parents can, you know, go and they can stay in their car and park. And with the laptops that the schools have issued, they're able to log into the free Wi-Fi that the school is providing. So again, there are more things that they're doing to try and think outside the box and try and get the help and the resources to our families as best and safely as possible.
All right, and this is Carissa here at Fort Campbell. The internet provider On Post has set up several hotspots in locations around the post that persons who live in On Post housing are able to connect to, and they can complete assignments utilizing that if they do not have internet service in their homes. And then Off Post, several internet providers have been offering services that they would provide connectivity to the homes that do not have it, so that those kids can connect. And all of the children have been provided with computers from the schools in the Clarksville Montgomery County school system. And On Post, if they did not have a device at home, they were able to pick one up from the schools.
That's great. Thank you. And I've heard similar stories. I know there's local providers that are doing it for either very low cost or free in some cases, not just for our military dependents, but for a lot of low income families all around, and roving mobile hotspots. I've heard of some communities converting school buses into hotspots in remote areas. So there's some great ingenuity out there. Well, folks, we are out of time. I think there might have been a couple more questions that Matt, correct me if I'm wrong, but you guys will bundle up and share with everybody after the event. Is that correct?
Yep, that's correct, Sal. I really appreciate your help today. And thank you to all of our panelists.
All right, thanks. Everyone have a great and safe day.
Great, thanks to you too. Thanks, Sal, for moderating. Thanks, Kathy and Matt.
You're welcome.
And I do want to echo Sal's comment about the questions. Even if you weren't able to submit a question today, you can definitely email us your queries, your issues, and we'll get to those as soon as we possibly can. I want to turn things back over to Kathy for a few next steps and closing announcements.
Thanks, Matt, and thanks to our panelists for a great discussion. I want to remind everyone to please check your email following this town hall. We'll give you follow-up information about this discussion and a post-webinar survey. Please take a moment to take the survey so we can improve and pick our next topics of conversation. Also, a link to that pain points poll will be provided in the email. That's both for community folks and for military families, so it's for everyone. Our next town hall, super exciting, Thursday, 3 p.m. Major General Deskins from the National Guard and other National Guard speakers. I know there's lots of questions around the National Guard during the COVID-19 crisis. Please join us again there. Check out our new website, full of resources to help you, your family, your business during this difficult time. Thank you so much for joining us today. We look forward to welcoming you at our future webinar. Take care, everyone.